I don't remember writing, we were just the part and stuff like that, so it's such a pain.
All right, let's go ahead and get started. Everybody's talking about their first day of school. All right, let's go around and do some introductions, and then we'll count for the quorum. I don't think, because I know some of you were here, some of you weren't, that when Jamie was here from county council, to have the quorum to vote, we have to be in person, like we don't have any sort of legal ability to hold it on Teams. So if you're a voting member and you're on Teams, essentially it's can't vote for those things. So anyways, anybody have any questions about that?
So we have a quorum in the room.
No, but one for
No, we'll have three.
Great. Well, let's go to lunch.
All right, let's do introductions. I'm Jeff Goldman, Chief Probation Officer. We'll go this way.
Ground analyst with probation.
Monday probation.
We'll jump up to the screen real quick. Tanya, if you want to start.
Hi, Tanya Clark, Courts.
Aaron Metler, County Executive Office.
Bob Jacobs, Sheriff's Captain.
Michelle Donovan, analyst in the DA's office.
Gary Klein, Public Defender.
Christy Thompson, Project Heart Women's Coordinator.
Mullen, Project Heart Mentor.
Paul Litchfield, probation.
Dan Foss, Memphis APD.
Angie Coffey, probation.
Steve Sinclair, probation. Alex Gilmore, Grass Valley PD.
All right, and so like I said, we only have 3 in person. We have 5 total out of the 7, but only 3 in person, so we don't have a quorum. So we'll skip approval of meeting minutes unless Jesse shows up in the next.
That'll be good having it tonight.
All right. So we'll skip over that. We have public comment. Anyone has anything? I think Project Heart's the only public comment. If you guys want to say anything, you're good to go.
Yes, I'd like to know that we, probably the September 15th, we will be Cal-Lane provider, ECM, so it's coming up soon. I have a special case manager for that. So it's a fun stuff.
You guys got a big grant recently, right?
Yeah.
You want to tell us more about that, or?
So it's with State Board of Corrections, BSCC, and that we have about $800,000 for housing money. $850,000 for housing money, and the rest of it's, case management for help reentry and coming out in prison priors. Even if they've had past prison priors, so that as long as it's California state time. And yeah, so we're just gearing up. We just moved our outfit. Call it our international corporate headquarters.
You still, are you at the one on Brunswick or you moved from there?
We're right next, we're at the Tall Law Building, right next to Humpty Dumpty's on East Main Street.
That'll save some travel there. So.
Right? Get up to log mileage.
No idea.
Yeah, we're really looking forward to that, so.
And for your grant, the person has to be a Nevada County resident, don't they? Is that what?
Correct. Correct.
It's really good. But he's not a Nevada County resident.
Right now, we're serving people in Placer County. Well,
You know.
Thanks for that. Just a quick reminder, selecting reps. The only ones that I had any written record of, doesn't mean you might not have told me this, but I have for the sheriff's office, Bob Jacobs, for the PD, Thomas Angel, for probation, Steve. I didn't have the other ones. So.
I mean, the only thing that I was thinking is all those are internal to the organization of the representative because they're established by title, whereas the police one is a police chief of the county. So I don't know.
So you name Dan?
Good. I mean, I would name Dan.
Yeah, Reese.
We're going to drag into this.
I think Renfro wants to invite over the hill for a noon meeting. So if that's possible, I would say if I was out of town or something, but I try to make these meetings.
That work for you, Dan?
What is again, so we get sort of.
To be the place rep if Alex can't make it.
Oh, yeah, that's fine. Thanks, Alex. Appreciate that. Good looking out. Yeah, that's.
My schedule's booking.
Yeah. We had on here, which, you know, we can talk about or we can postpone, the Innovation Fund long-term discussion. So the last time we met, we had talked about the Innovation Fund and how, like, if it's a promising program, how to kind of fold that into the funding kind of, the formula or the idea behind that. And so, you know, one thing that I was thinking about that we could do, you know, if there's innovation fund, like something goes through the innovation fund and they report out and, you know, it's some sort of program that we want to keep going, that there could be a mechanism for them when we do our normal funding request, either that be through a department that's leading that charge, or that could be through that group, however we decide to do that, for them to continue on that programming, because that's kind of a difficult point, I guess, if there's no sustainability plan and we do this innovation funding and then it's like, okay, well, we don't have funding anymore. There goes your program. So I don't know if anyone has any thoughts on that. Angie's sitting down there, so she can't kick me under the table.
Been kicking me.
Yeah.
Seems like if there's a department that's particularly suited to that program and whose clients are using it most, that maybe they are championing that program as a potential, you know, for the CCP to fund through our normal budget process.
Like they have, I can almost pair up and sponsor the department sponsor. I think my concern would just be that over time, we could really increase the expenditure side of things if that was kind of always the evolution, you know, innovation to now a long-term funded thing. So I think Carrie's idea is one good way of doing it, and then the other one might be, I think we should see the metrics.
Other grants, I mean, there are a fair number of grants out there that the county can apply for and pass money through to CDOs, where we have to. You know, 50% of it must go to community-based organizations and those, and so I mean, maybe we start looking for those and.
Since you don't want to
seeing where they
chasing
spend.
grant from chasing grant to chasing grant, but I do see it as like, maybe it's like a bridge funding thing and help them work on sustainability. I would just want to make sure that this group would recognize, like, if it fit into Carrie's wheelhouse, that it wouldn't be like, well, now Carrie's allocation is 20% or whatever. That it wouldn't really, not saying that it would ding you for your allocation, but we wouldn't look at it in that light. Like if probation was carrying like 6 programs, that's like, oh, probation's getting all the money, but it's like, it's just passing through us, you know?
Because like I sit here and I think about the one we just funded, and if it's effective and successful, it's my clients who are benefiting the most from it because it's enabling them to do the things that they need to do, which then means my department probably is the appropriate one to be championing. I need to use a different word, to be supporting that, you know, request. So.
Yeah, and I think we should just, if once it moves out of innovation, because innovation oftentimes is a new program with little data that's gonna, has a premise that they're trying to achieve, but then if it's gonna move into a longer term funding situation, I think we have to make sure that it serves the clients that AB 109 is designed for, and then show us the data that your innovation program is worthy of funding in the longer term, or at least with these other dollars. And so I really think we would need to have a robust data set behind it, and I think that's where that supporting department might be a good fit.
So I think one option is we could type up some sort of proposal to essentially vote on at the next meeting, to fold into, because we have that in our bylaws, the like budgetary process, that we could fold something into there potentially. That would capture that. That works.
I don't know, I mean, I don't know if I'm allowed to comment on this now. I mean, I probably should read the agenda because I love the idea. I think that that's awesome. Obviously, I have to be careful on this because I don't want to sound like I'm self-serving. I just received innovation funds for it, but I think I made it clear when I applied for innovation funds and I'm kind of a fan of CCP. But I also think that's beholden on the people that are receiving it. Can they prove that they've made a difference with the innovation, right? If the test, if the theory pans out, then I think it makes a lot of sense that CCP funds continue to support theory that pans out. It's a heavy burden, but I think it's a fair burden, right? If you're giving somebody limited resources, I mean, limited by what I mean by that is we don't have infinite, then we need to see progress, results. So I don't know. Yeah, I was here to speak on pause a little bit. I don't know if we tie it into that now or later, Jeff. I don't know where.
Let's put a bow on this one and then, so yeah, we'll put something together and like Alex was saying, there'll have to be some sort of, and I know this will go through the budget process, but making sure we don't get too far ahead of ourselves in like funding a bunch of innovation projects and then feeling like we're on the hook to continue that funding and then it just grows and grows and grows to where, you know, it's not sustainable. There has to be an off ramp at some point for some of those folks to be able to sustain themselves. So. All right, yeah, we can go to pause. And so, I mean, I'll try to tee it up for you, Dan. So there was some questions about some of the things and some misunderstanding about, I guess, when people drop off their pets and the contract and those sorts of things, which from what I understand, got worked out with behavioral health and some discussions with them. But I just encouraged Dan to maybe come over here to talk through that. So there wasn't any, because obviously there were folks that were here that had a different idea of how it would roll out. Then
Yeah.
Everybody wasn't on the same page anyways.
Yeah, I don't know if it was anybody that was here. It was kind of when it went down the chain, like the announced play chain communication, and it gets confusing. So I think I'll start with an update because you guys all deserve it. Because thank you for funding pause. We haven't got it yet, but I'm floating all the money, so I'm waiting for that check to come through. But it's already taken off like crazy. We have 7 clients currently, so we have 9 pets, I think, that we have in foster homes, which is a little overwhelming for us. We weren't expecting it to be that big, but that just shows that there was a huge need for it. I think, and I'm going to misquote the numbers here a little bit, because I think we've assisted with 11, or at least reach out to 11, and not everybody qualified for it. What Jeff's talking about, which I do want to emphasize, but I also want to emphasize that I'm open for any feedback from any group or community on how we could do this better, because it is brand new. But right now, the way the program is set up is if a client, and we want this to be as clearly communicated as possible, so there is no miscommunication. So there was a miscommunication on this part right here. If a client is seeking the assistance of pause, so they're going to go into a rehab facility or whatever it may be, not always rehab, sometimes it might be incarceration or whatever it may be, but they're showing that they're going to do progress to try to better their situation. We will assess them and we'll take the pet into our ownership and control. So the pet is completely signed over to pause. I don't really see another alternative for that because it's up to a 24-month program. If the pet needs any medical services, if it needs any emergency services, then we kind of have to have ownership of that now. We'll go to a bit. What's that?
With pets, I mean, I don't know. The attorney in the room can speak to this better. Like with pets, is there some sort of legal?
That's a property. So yeah,
Isn't it?
You got
Is it like a power of attorney for a pet or something?
I think it's like different for cats and dogs too.
Petition the court for temporary custody.
it's property, and so you're gonna have somebody else in charge of your property.
Yeah, primarily liability related. Yeah.
Well, that's not if you still own it and something
Yeah.
bad happens, you don't want to be
It's also-
liable now for it.
Exactly. I mean, someone's sitting in rehab and their, dog goes and bites somebody and like,
Well, I'm just thinking like if I have a pet and I don't want the pet anymore and someone comes and takes the pet, like I'm not signing like a title or something, like
There's no title to be, so it's just more of a
They
contract.
just take it and they go away.
And custody.
Could be word of mouth, like if you buy a, yeah.
Even
I get
call
it.
me to work this out, that's fine.
But we sign a contract with sure that they sign over ownership, but I mean, even more than that, I think it's important because if they are in rehab or if they are in custody and, you know, something could happen where they come out and they're agitated. They still own that pet if we don't have some type of paperwork, and if they call the police, that's an issue, like, yeah, basically, where's my pet and give it over right now. So anyway, they do sign the pet over, and in our contract, and we've reworded it again to make sure it's clear as possible. But the contract states that when you sign ownership of the pet over, we'll keep it for up to 24 months and longer with board approval. But before you re-obtain your pet, you have to show that you've either completed a rehabilitation program or are able to provide for the pet in a safe and caring environment, as directed by the board. So where there was some confusion, we had somebody go into rehab, they dropped out after 6 hours, the pet was pretty bad shape, went to a vet, it creates pretty big bills. And there was a misunderstanding with that is not, you know, you have to get the pet back now. So in that case, we're always going to err on the, you know, we're always going to work together and figure it out, right? But I want to make sure that we don't have that confusion again, that's my understanding of it. I think the best way to work this, and I think there's many reasons for that encourages people to actually get better too. If they do want their pet, it encourages somebody to, and I said it before, and I'll say it again here. It's called Pause. A lot of people think it's for pets. It's for people. The program I want to help people first and animals second, and really it just kind of helps everybody. So win-win situation.
Just from that situation, just for clarification, there's a threshold that's in the contract to get the pet back of, I mean, and you can clarify this of like treatment completion, suitable living environment.
My main threshold for me personally is suitable living environment. This was a cat. The cat went to the vet, had major abscess. I mean, she loved it, clearly. It was healthy weight, but it immediately accrued quite a bit of vet bills, which is not a big deal. We expect that. And then the vet said this is not a cared for animal. It was a younger animal in pretty poor health. And then it was unaltered. So it would clearly been because they were living in a trailer with power and everything. So it had clearly been fighting with the other cats. And we all know the cat situation on the street. We're releasing it now into, you know, probably not the best situation for anybody, not our community, not our client, not the cat. So it is case by case. It'll always be case. We had another client that did something very similar. He released a dog, dropped out of rehab rather quickly, wanted his animal back. We released the animal to him, no questions asked. Why? He was living with family. So we knew the dog had a safe place to go. We're not trying to do punitive damages here, but we were immediately able to say, okay, this pet's going to a good place. When you're ready to go back into rehab, call us again. We'll take the animal. We'll try this again. We know that the first time is not frequently the last time. So it is case by case, which I understand can sometimes be open to interpretation very much. But on our board, one of our board members is a vet. She does own 4 paws, and we rely a lot on her input. You know, how's the health of the animal? What's this looking like? Was it cared for before? And, you know, we can make pretty good assessments of the individuals of where they're at before too, if it's going to a safe environment. And trust me, we don't want to keep any animals. We have 0 foster families. Our goal is to get these animals back to the people, because the foster families is really, is anybody want to foster? That's the hardest part right now.
No, we're doing it. Paul wants to.
But I would like to, I mean, even going back into the information and all the rest, I think it's really important. I would love to, in either the next meeting or the meeting after, have a full presentation for the board with a PowerPoint of where we're going, who we're helping, how we think it's going, feedback. There's a lot of, you know, great expertise in this room alone of what can we do different. This is brand new. There isn't another one we're really basing this off of other than one out of Texas. So we don't have a lot to go off. So we're going to make mistakes along the way, I promise you. And I think we're going to be making some good progress and helping some people along the way. So I'm excited about it. other than the fact that we have already signed up for a grant too. We did in partnership with the city, so hopefully that helps. We applied for 140, I think. So we just applied for a grant. We'll see how that goes. It's usually gets the feedback in September. So we'll find out. Yeah, it's going good.
Any questions?
Thank you.
My only question would be on the contract, like you have a stated, a statement that says that reunification of the animal with the client is the highest, priority, but then maybe put some reasons in there as to why that couldn't occur. You know, health of the animal, safety of the animal, safety of the client, whatever, and then that might be a way to just, it's almost like a statement that says, in all cases, we're gonna try to reunify the animal, but there are some cases where we may not, and then the default becomes reunification.
You know, we don't have it worded like that, and I think we should actually. I like that version, just like you said. I mean, because the highest priority is reunification. We don't want to keep these animals, and everybody knows, everybody has a problem with it. So
It might help with acceptance of the program, because I can see some people signing it over being a barrier, saying, I'm not doing that because I'll never get it back, because there's trust factors already. So having that there, but then it would also help because then it would outline the reasons why maybe somebody wouldn't get an animal back, because not in all cases would I think that might, you know, I would think in most cases you could find solutions to get the animal back.
Get it
Or maybe
back.
somewhere it's just not.
I think we will. I mean, even the solution where it didn't work out, or it did work out, but we were telling her, hey, if you can show that you're sober for up to a week, we'll turn the animal over. And that was kind of just trying to incentivize it to get sober too, to maybe. But we're always going to try to come up with some type of solutions to get somebody back. I like that verbiage, Alex. What I can do, what I should have done, is I can send you, Jeff, our contract currently, if you could disseminate it out. And if everybody, it's pretty short read, if everybody could read it and just give their feedback what they think. Because not only do I want people to sign it, like you said, Alex, I almost want people to be discouraged. To like, I don't mean to say it that way, but I want them to understand the seriousness of what they're doing. I don't want there to be any qualms about it. Like, hey, you understand that you're signing this pet over and we're going to take care of it absolutely. And we want it to come back to you. But when you do get out and, you know, when you drop out in 2 days or 3 days, we don't want you saying, hey, no, that's mine, give it back. And we might, but just understand that we might not. If that makes sense. So I'll send it to you, Jeff. If we could send it to her, that'd be great. I'd love feedback on it.
That works. Any other questions?
Yeah, I mean, I wonder how you're weeding out the people who are saying, yes, I'm going to rehab, and they desperately need to go to rehab. They also have a sick animal. They're leaving it with you. They're going to rehab for a week.
Just try to get the medical treatment.
Yeah.
So
Going back out.
we're working through that, but mostly through the board. So you all met Liz. Liz is wonderful. She has the biggest heart, and we're working through it slowly because I think I'm a little more cautious about that, but she is, hey, they need help. We have to give them the opportunity to get help. And so we're being.
She's not as cynical as some of us.
So, but she's learning quickly, like, oh, shoot. So what we're doing kind of right now is having the dog go in or animal go in to be diagnosed, but not treated. So we're saying, okay, here's all the things it needs, but we're not treating it for 7 to 10 days. Basically, if they drop out immediately saying, hey, this animal needs a lot of care. So now we do get into that situation now, like, are we going to release the animal? Which probably we are, which is unfortunate if they're in at least a household, but we're not hit with that upfront cost of all the medical bills. Other than altering, even if we are going to release them, if they sign it over, I'm trying to get them spayed or neutered, just so we don't have a continued problem down the road.
We have, Liz sent me a copy of the temporary surrender
Contract?
and then kennel and boarding partners. I don't know those two documents. Have those been
They
changed?
have, they're gonna change a little bit since the conversation with behavioral health. So let me send you the upgraded one. And send that out. It was very subtle changes, but there was some changes, so I'll send that out.
Never thought in this job I'd be talking about the care and control of pets, but especially you.
Yeah.
Yeah, I know. Jeff's been since day one. Why would he?
I ask him anyway.
Oh, my gosh.
see them all over the place. Popping out of the garbage can.
They're not supposed to be. Supposed to have a suitable living
They
environment.
look like they're doing just.
That's why they're for kids.
Right.
When you go to Germany, you do not see stray animals, not even stray cats.
Really?
Yeah, it's totally illegal to have a stray cat.
How do they fix that?
They fix them.
They fix
Oh, I
them.
guess that's it.
They, to adopt a cat is very, very hard.
Lasagna, lots of lasagna.
And you have to adopt two.
That's right.
Because
He loves
if you're adopting an animal, you have to get two because they think it's cruel to only have one. Because you leave during the workday.
Yeah.
Companions.
Like chickens.
Yeah, and, I mean, it's very interesting the way they do it.
That is cool.
Yeah.
Anyway, that's all I have. Thank you, everybody.
Thank you for the update.
Next thing, Brendan is going to, as his data presentation,
Then we're gonna share drums. The dashboard. And so we're at a place now where we're sharing data, we have a dashboard, and we're looking for feedback on it and ways to utilize it to guide decision-making. Couple of drawbacks I feel like right now are we're just sharing it once a quarter, just for a few minutes, so it's kind of hard for anybody to, get a lot from it, seeing that infrequently. So, maybe we could come up with a way to share it more regularly. And another thing is, right now, the way we're sharing the data is I'm receiving like a report or something, and then I'm manually moving the data over into a spreadsheet that feeds this. But in doing it that way, you can't really track things over time. So, ideally, like if we could set up a data warehouse or something like that, it could be more of a live data that tracks things over time. So this is what we have right now. So for like the rearrest and new conviction rates, I broke out recidivism into those two data points because there can be some lack of clarity as to what we're talking about. So instead of having just a recidivism rate, we have those two rates. When you look at the year on those, it's a cohort model. So that means they enter supervision on that year and then they're tracked for 2 years. That's where the data is derived for that. We have population over time there for PRCS 1170. We've got the AB 109 jail population for time. That's right there is representing the fourth quarter of 24-25. And then of course, this collaborative report summary, that's kind of a breakdown of clients served by the collaborative reports.
Is that AB 109 jail population inclusive of PRCS and 1170 combined then?
Yeah.
Okay,
So, and is that parolees?
and parolees.
Yeah, the 210 though, is that cumulative over the entire quarter of days or people or?
That's an average. Which one?
It says 21.0, I think. I'm
21.0.
not sure about it too,
It's
but
a daily.
0.0.
Daily average for the month.
It's like 210. Well,
So it's not cumulative for the month, that's an average daily.
That makes sense.
So like in the interim, if we wanted to go the route of having a live dashboard in the interim, we could start by sharing out a PDF at intervals and then move towards long-term solution. Then that we could take more time to look at it and come up with ideas on ways to improve it.
So, I mean, usually my direction for this kind of stuff, because our department has a ton of different dashboards that tell a bunch of different things. Is first deciding like, is it useful? What we're collecting is useful. We're not just collecting it to collect it. And what are we doing with it? Like, are we using this information to inform, whatever it is, whether it be budget or programmatic or however we're using it? And does this tell the entire story? Do we need more information? Do we want to drill down on some of these things? Do we want additional things? Those sorts of things. And so I know that it's been hard to get the data group up and going. So at some point, I think it would be nice if, the department head hops on for however long of the next data meeting with
whoever they assign as their analyst or their person to it, if they have a person, yeah, I'm looking at you, Carrie, but,
I don't have a person, so love to be able to hop on, but the meeting's always when I have another meeting going, so.
to try to show us, what kind of data we want. And I think we talked about this, I think at our retreat or whatever you want to call it, that we had when we kind of dove into some of this stuff, is like, in theory, and participation ebbs and flows. I think the last two meetings, it was decent participation. But it's one opportunity to discuss stuff beyond AB 109 and use AB 109 to kind of delve into other questions or concerns that we might have. And to add to that, like if we want to research some of this stuff, it seems like, given some changes in federal funding, there's been a lot of researchers reaching out to me lately. They have a lot of free time on their hands.
Yeah, they're looking for money.
That either that or they have funding through a different source, through a university or some other think tank type place, but they just don't have the same direction that they used to have, I guess, that are looking for stuff to do. And one thing that Steve brought up the other day that got me thinking about this was that, we see the booking sheet every day, and I don't know, I can't quantify it.
Shockingly, just say shockingly.
Yeah. The majority of the bookings are DV and DUI, and I'm sure there's some researcher out there interested in ways to address this when, the community has as much of a percentage of DVs and DUIs. And I'm assuming that sometimes those two activities go hand in hand, drinking and domestic violence, but
I think too, though, that what you're seeing is a reduction in booking and a higher incidence of filing. So I would be getting DA numbers on that because I think we're seeing a higher likelihood of not booking into the jail. But I don't know that the incidence of arrests is down as much. I mean, I think arrests are down, if crime's down nationally and locally, but I think that I think those are kind of DV, for example, is a non-discretionary booking in most cases. And then the DUI, similar. I mean, I know that there's provisions now for citing a DUI, but depending on the circumstances of likelihood to reoffend and the risk to the public, those are oftentimes being booked, although short stays. So I just wonder too, if maybe.
Yeah, and that was just an example of, like we could use data to see if that's something we want to dig into, or it could be something else, but there is that opportunity and bandwidth there to possibly address some issues, but address them through the CCP, because essentially one of the tenets of the CCP is using, evidence-based practices to solve some of these community problems. So if we had the data to show that that was an issue, then we could use that to have some of these folks that are interested in doing some of that work come and at least help us out and give us some insight into those things.
As far as this, and I can't see the percentages, but I like the rearrest rate, the new conviction rate. I think that's been, I won't say it's been a beef, but it's been something we've talked around this table, that the different agencies are looking at different stuff, but some of the data that we've presented has been very probation centric, right? The stuff that we are also looking at. So I kind of like the addition of another rate, and we can, and we have access to it. But, even maybe digging a little bit deeper on like the new conviction rate, like are what the breakdown of the misdemeanors versus for new felony convictions, stuff like that. Just give us a better picture of the community and the county of kind of what we're looking at in the general.
And one that I had in the past at a previous employer was the police were interested in SRF hits and FI contacts for the AB 109 population. So they fed data relative to their contacts to us to show that, and they wanted to illustrate, sure, you have this rearrest or this new conviction rate, but out on the street, this is impacting us because we have way more interactions with these people because they're periphery in a call to service or something else where they didn't actually get arrested, but it's impacting the work that we're doing and how to address that. So,
you know, how that looks. I mean, that's one thing I think our dispatch uses Audubon more than they use Collect sometimes on folks, so you don't always get the SRF hits on folks, but
I don't think our folks are entering SRFs at the level that they did.
well, I mean, we
15
enter
years
it
ago.
in, so if there's a contact that they,
Yeah, we have to do some research on that. I think they can. I just don't think they are.
oh yeah, that's what we've done. Yeah, we've had that conversation because it's helpful for us to get that information as well. But those types of things, you know, and, you know, it could be, maybe it's case processing through the public defender's office that you guys want help on, or whatever it is, that we can use some of these funds to work on those issues. So. Any questions? Anything that just pops out that people are like, oh, I would really like to see that?
I have a question. The mental health court numbers, is that mental health court only, or did that get combined with like mental health diversion?
It's just mental health court.
Okay, because I just did my reporting and for the fiscal year, and I have about half that number, a little over half that number.
Okay, let me pull up the report right now, but I think I can show you guys, but we have a different selection for mental health court diversion for this specific report. It should just be mental health court. But that pulls, oh, okay, 1 second.
Tanya, I mean, not exactly to your point, but maybe that's something like people would like to see the breakdown of like the IST folks or the health burdens, you know, and all the different groups, because those do impact, you know, less people being in different other, especially courts.
So that's not like it's snapshot, Tanya. That's everybody who's touched that system in that time frame, right?
That's the last quarter.
Last quarter.
As a subset of AB 109 clients.
ABC in
No, I can't even read that.
I don't know if that's,
If you were a non-AB 109 client that had mental health court, it wouldn't show there.
No, what?
It would. This is just all.
everybody.
Yeah, I don't think we have
But why
AB
would we only have
109 people
15
in.
DUI? That seems low compared to.
So the DUI and ADC is pretty much spot on with what I reported. So, but mental health court is not. I think I reported 9 total served for fiscal year 24-25. And that's pulling a report out of our case management system.
Okay, this is from our case management system also, and we do have a separate code for only mental health diversion. So maybe you and I can get together at some point and go over this and see why they're not the same or not matching up.
Yeah, that sounds good.
Okay.
but here's just a thought. So this is one reason why it would be advantageous to have a data warehouse where you could set it up to de-identify people, but on the back end, you could do matching, like fuzzy matching, you can match on name and date of birth, and then, you know, these sort of discrepancies could be figured out. All the data would come together and be aggregated.
And showing it, like you were talking at the beginning, like instead of once a quarter, people having access to seeing it. So if they see something that's off, they could do.
Right, and then also, in doing that, you could track them through the system. And if they're going through the system multiple times, you could look at the different intercept points.
Well, there is a project.
I wonder if, like, Tanya, are your numbers people who are newly admitted to mental health court? Or is it just anyone who's in it, they've been in it for a year and a half, they're still gonna be in your number for the year?
Anyone who's been sentenced into DUI court, so anyone that's been served for that fiscal year.
This is, I mean, another spot for overlap of where on some of the stepping up work, there's talk about creating like an XREF, like a county ID number, like a numeric identifier that follows the person through everybody's system, whether that be behavioral health, probation, PA or whatever, so that it makes these tasks a little bit easier.
Here, okay.
So I think next steps, we'll send this out. People can look at it, think about it, memorize it, digest it. to see what other information that they'd like to be included on there, so. There's no put downs and brainstorming.
You can send out like a PDF or something to look at so we can.
Yeah, I mean, I could send out the link. If you have a Power BI, I could send you a link. Like I said, I'm both.
You have to be a county entity, right?
I don't know about that. I can find out.
Go
Yeah,
with
Power
PDF.
BI, it's just a document type, right?
Well, you can send
I don't know if you
I
have
can send a file, Power BI file, or I could send a link. Yeah, I could send out the file. There's no way to stop people from viewing the files on the Power BI on it. Installed on there. I don't know why it's not right.
Yeah.
All right, is there any other questions?
Subscription.
And when I said something about the DV and DUI, is anything else, I mean, while we're sitting here, pop up in anyone's head about any other things? I know Alex and I have talked about some evidence-based policing stuff in the past. But I don't know if there's anything else that anyone had where they're like, oh, if we had some funds relative to doing some evidence-based practice work, this is what I would focus on. Or these are some issues that I'd like to see addressed in the community. Yeah, all right. Nothing for you. Jacob, no, like too many UTVs coming out of the town of Washington or something?
We got other funding sources for that. Yeah, I'll just throw out, I apologize about being so quiet. This is my first CCP meeting, and I also apologize for not being present. We had several issues in the jail that I needed to be present for. I am new to the jail, been here about 2 months, so I'm still trying to wrap my head around all things corrections. I know CCP is a priority for the sheriff, so I vow to be in attendance personally and in person next time. I just need to really kind of get up to speed on the data you guys are collecting, what we're doing to assist in that. If there's more we can do to assist in data collection from the databases that we maintain. I really just need to kind of wrap my head around it before I'm going to have too much input.
Yeah, no problem. I didn't mean to call you out.
No, you're all good.
All right, the other thing I had on here before we wrap up, I just had legislative updates. I mean, I don't know if anyone had anything to share. I'm guessing each of our professional groups, there's probably some overlap in things that are occurring. It wasn't too much really pertinent to this group. I mean, other than there's a bill that would require CDCR to provide the probation department written and verbal notification of scheduled release date. No less than 165 days before a person's release, which gives us a better heads up of when people are coming out of prison, because I know probably not as much here, but some jurisdictions, when you get several, the day of, doesn't really help in that reentry process when you don't know they're coming. I don't know if anyone else had anything else. I mean, probation wise, there's a lot of other stuff, but most of it's in the juvenile world. I said LA is going down fast on their juvenile probation side, so there's legislation to try to help them in potential receivership coming up. So
The rest of us vote for that to make sure that happens, has to be done. And where I look at.
CPOC did hint to that, I think 6 months ago. So
Like booting LA.
they're not booting them, but that it might be time for an independent party to help them get back on track. Anyways. Anything else from anyone else? There's not new laws about Surons driving down the street.
Actually, there are some e-bike laws that are working their way through the legislature right now. I mean, there's some on the books, but yeah, there's that. And there's a lot on immigration and face coverings and enforcement, topic right now.
I'm tired of those Surons.
I know the Surons are getting a little crazy. It seems to be a increase of them.
All right, anything else? I think that's about all we had, since we can't vote on anything today.
Alex is taking everyone out for lunch, sorry. That's fun. Thank you, guys. These keep me asleep. You have like a whole gang. Part of me is like,